Well, I'm really excited and honored to introduce Team 7, led by our coach, Andrea Vaughn, for the 2025 Interdisciplinary Geriatric Case Competition. So just to start out, we created an outline to create an overview of Miss Staples' case conceptualization, and then to also maximize our organization. So we'll start with a patient overview, go into a case overview, introduce the team, talk about some barriers to care, plan of care, and then end with our conclusion of our goals. Great. So at the forefront of our patient care is Miss Carla Staple. And so I've organized it based on her background history just to set ourselves up for when we talk about her plan of care later. So to start, she's a 79-year-old African American female who trained as an LPN after high school and served in the military during the Vietnam War. She left and became a second grade teacher due to a sustained injury. So who's in her family? So her family is in a strong tradition of military service. Um, who is her caretaker is Hank Staple. They have five children, including Anthony and Janie, who are very involved in her care. In terms of social support, she gets support from her immediate family, close friends from church. However, due to environmental circumstances, she has a limited social network, and she receives care from her husband, Hank. As mentioned, there was a flood in 1982 and a current flood that has led to barriers to care, including financial access, reliable transportation, and then the VA clinic was damaged, which has affected her overall care. So, in order to look at things from a biopsychosocial perspective, I separated out her care into medical, environmental, and social so that we capture all points. Within the medical, she had an amputation in her left leg. She has several autoimmune diseases and then cardiovascular risk factors. As mentioned, there was a severe flood, and now she is currently living in a FEMA shelter. However, this has disrupted a lot of access to care for her and her family. Hank is her primary caretaker, including her children, Anthony and Janie. Um, Due to the environmental factors, she is at risk for isolation, depression, and she endures feelings of guilt, sadness, and dependence that we'll talk about later. Great, and I'll hand it over to Joseph to talk a little bit more about our team.
Yeah, thank you so much, Peyton. Yeah, in order to address Mrs. Staples' situation, we work with teams across different disciplines. We had people from dentistry, from social work, physical therapy, nursing department, from medicine, from clinical neuropsychology, but also we work together with the family members from Mrs. Staples, the husband, the son, the daughter, but also with the dog who was very supportive to Mrs. Staples. So also we work with the consultation from other disciplines. We had people we had professionals from pharmacies, we had occupational therapists, but also we had nutritionists, just in order to provide a comprehensive care for our client. As the team, we came out with a very broad perspective goals in order to make sure that we provide a comprehensive and holistic care for Ms. Staples. Number one, we as a team, we think maybe we thought safety should be number one priority to her based on her history and what happened after floods. But also we optimize the medication adherence, like making sure we are linking her with the pharmacist, we are providing and organizing her medicine, but also to promote her well-being, linking her with the church members and provide an emotional support, maybe from mental health programs. But also we focus on physical function, nutrition as well was important to her, but also hygiene and exercise programs to Ms. Staples. Let me hand over to Hannah. Thanks.
So there are some barriers to Miss Stapler receiving optimal plan of care. Some of these include lack of transportation and internet access, living in a rural area, the flood that recently occurred, and Miss Staple having a self-reliance attitude and not necessarily wanting assist from others. And we will address these barriers in the upcoming slides, and I'll hand it off to Amy.
Great. So there are multiple barriers to Ms. Staple receiving medical care she needs, including transportation assistance to get to important medical appointments, especially after the flood. So there are some resources would be Oates Transit, the Missouri Department of Health and Senior Services, and there's also a National Volunteer Transportation Center map that can be used to find services nearby as well. Another important need that she has is adequate internet access so she can attend telehealth appointments as needed. And so there are many internet providers who provide military discounts, and the Lifeline program by the FCC may provide free services after natural disasters to help keep Miss Staple connected. So in the community that she lives in, it is a rural community, so she should be able to utilize agencies, especially working at the FEMA shelter she's currently staying at. One of the things that I would help her do as well is to fill out forms for Purina to donate dog food, other pet supplies for Georgie, since we know that Georgie is important. Also, I can familiarize Ms. Staple with the local senior center to be referred for Meals on Wheels to help provide her with nutritious meals. The senior center may also be able to participate in Call a Ride or Dial a Ride, so she can have transportation to do what she needs to do. Also, just during this process, I will be meeting with her as often as needed, but especially weekly, just to help with any additional needs that she has. I believe she will benefit from a referral to the hospital chaplain and maybe the Salvation Army services, both during and after the flood. And then I can assist Ms. Staple also with reaching out to church members to provide additional spiritual support as well. So she does have several barriers to receiving the medical care after the flood. Currently, she is only using VA benefits, which means that she has to be seen at VA recommended facilities, and they do not always have full access to her records, her medical history records. So when using the VA benefits, especially we're thinking about continued care after hospital, continued therapy, things like that. She actually has to be seen at a VA clinic or the VA emergency room to receive the longer term care and physical therapy that she may need. And so once she is seen at one of these, it can take a couple of weeks or even more just for the future needs to be determined, referrals to be sent out and her connected to those resources. One of the things that a social worker can assist her with is applying for Medicare, which really would just enhance the insurance benefits she already has available. So once we have her enrolled in Medicare, she will not be able to receive or to bill both insurances for the same services. However, this really does allow for there to be no gap in the care. And so she will be able to be seen in both community and VA settings, depending on the situation. And so, for emergencies, ambulance services can be covered as well. And so I think one of the concerns that she has is she's only has a 30-day supply of medications. Being unable to go to the VA pharmacy is an issue. We know that our patients really do need to continue taking their medications as prescribed. So we may be able to help her enroll in a Medicare Part D plan that can allow her to fill medications in community pharmacies, which will decrease the risk of missed doses.
Great. So this is the next slides are going to be our plan of care from each discipline to make sure that we're capturing her and her support team's needs. So I'm going to hand it off to Devon, who's our medical specialist on the team.
Hi. Okay. Yes. So I've divided up Miss Staples because issues with the immediate condition, the pain and the inflammation at her site of the prosthetic, and then the rest of her conditions are divided up into the other organ systems. So going first with the pain and the inflammation at that site, she will need to be seen at the hospital inpatient. Now, it's noted that she prefers outpatient care or to be at home. But given the comorbidity she has, there's a history of chills and redness and some trouble to call some names. I'm concerned that the infection is a little bit more severe, so she will need to receive the treatment at first at a hospital inpatient IV until she's more stabilized, and then she can continue to receive that treatment at home on an outpatient basis. And then I would like for her to switch up those NSAIDs with Tylenol because chronic use of those NSAIDs can lead to stomach problems, and we don't want that for Mrs. Staples right now. Yes. So for the arthritis, which is currently being treated with as a thioprin, and is treated or it's noted that the treatment isn't as good right now. And it could be because of as a thioprin, it's not first line because treatment for the RA. So I want to change that out with methotrexate. That's first line. And for the lupus, we can continue with the azathioprine. For the blood pressure, it's still high, so I want to change that out with lisinopril because right now the amlodipine, the effectiveness doesn't seem to be where it needs to be, and there's also a side effect of some mouth things, and she has some issues right now with that, so I want to stay away from that. So I want to move over to the lisinopril. Also, her cholesterol is still high on the pravastatin, so I want to change that out with the torvastatin as well. It has a longer half-life and better potency. Yes. Moving on to the behavioral health, there's a history of depression and grief. And so I want to put her on the sertraline. Uh, because at least until the situation that she's in right now is better resolved, because she was on it in the past, she's currently not taking it, but I want to see her back on that for right now. There's also a PTSD in the past. She's sh and having flashbacks of her time at war. She's not currently having those flashbacks, but I want to get ahead of that. So I do want her to get started with therapy, just to kind of prevent that from coming back. There's also some hair and nail changes, so I want for her to be properly counseled on proper diet as well, just to make sure that we can kind of reverse that. And so, given all of these changes, that's a lot of medications that she could be taking per day, up to 7. So, I'm a little bit concerned about polypharmacy. So, I do want for her to get set up with nursing and social work just to ensure compliance and proper organization. And with that, I believe we hand it off to dentistry and nutrition.
I think we have nursing
We have
first.
nursing.
All right, thank you so much, Dr. Devon. Of course, yeah, from the nursing perspectives, I think it's very important to prioritize her nursing care. And at this context, I should focus mostly in the immediate needs as presented by the physician area. So the immediate needs would cover the acute pain because she's currently in pain right now, and I should focus also in inflammation, making sure that she's free from infection. But also, the most important thing is just to make sure that she really understand and she really and, receive a coping mechanism. Like we know that she's not with the family members and other close relatives, so that should be among of the nursing care plans. So in this context, I should provide the prescribed medication based on the prescriptions, but also I'll focus on monitoring her body temperature, but also making sure that the pain level is going down and she is not experiencing any kind of pain. In the long run, Ms. Staple, she really needs a lot of caregiving support, as we know that she's no longer staying with the with the family members. So as a nurse, I should focus more on providing counseling, emotional support, and making sure that I reach out to the close relatives, maybe through mobile or through video calls and or other resources that are available to make sure that she's connected and she's not having that sense of missing them. Yes, so that's from my nursing perspective. Let me hand over to Pedro.
Okay, so I will be going into the nutrition. We want to prioritize some protein-rich, stable foods for her in this time. So we're looking at like peanut butter, beans, milk powder, especially because with the flood happening, a lot of her lifestyle eating habits are kind of all over the place. We want to make sure that she's able to keep these key nutrients. So we're going to have that be a priority, including a hydration plan as well, making sure that she stays hydrated on for the nutritional aspect. And then trying to treat some of her conditions with just healthy habits to help with that rheumatoid arthritis and lupus. We would want to reduce some inflammatory foods. So we're thinking like that refined sugar, fried foods, and encourage more omega-3 sources. And then we also want to make sure that we can help her long term. And so that's where we would do this education and counseling for this lower sodium options and encouraging a smaller, more frequent meals due to her having a low appetite. We want to make sure that she's still eating and not discouraged from that. And to kind of help with that, it would be to change that habit. And then as we move over to dentistry, she does have a couple ill-fitting partial dentures that we want to get re-established for her so that she's out of pain. Those can be very uncomfortable. And it would also hinder her ability to eat and provide nutrients to her body so that she can deal with all the other things she has going on. She reports some pain, and so we need to do an examination to detect exactly what that is. We have some possibilities listed here. And then we also need to assess the diet and dental hygiene capabilities. Seems like she might have some difficulties with the normal daily cleaning and hygiene due to some of that arthritis and other issues. So our plan is going to be first to relieve that pain with an emergency appointment, diagnose and find what is causing her that jaw pain, and then helping her get comfortable and out of that situation as fast as possible. We also are going to give her a comprehensive cleaning and exam, treat any other diseases or decay that we might find, and then realign those partial dentures so that they're usable again and that they're not a hindrance to her nutrition. Going forward, we want to make sure that she is educated with the proper hygiene, and that we're also giving her an electric toothbrush so that that limited mobility of the arthritis doesn't really hinder her anymore. And then we would want to establish some recall appointments and make sure that we can continue with those radiographs in the future and proper denture care to stay away from any other possible pains that might come in the future.
So from a physical therapy perspective, we can see that Miss Staple presents with decreased mobility because she requires increased assist for transfers and ambulation. So the first thing I'd want to do is to provide her with a front wheel walker, which she can obtain through no cost through the VA. And the use of this walker will help to improve her balance deficit, increase her independence with transfers and gait, and then decrease the assist needed from her family. After providing this walker, I will provide gait and transfer training to make sure that she's using it correctly. And then I would also provide family training, which would include how to don and doff a gait belt and how to assist Miss Staple with transfers in a way that's safe for both her and her family member. So this would include education on proper body mechanics to increase or to decrease the risk of injury for everyone involved. I'd also provide her with a home exercise program that would originally focus on lower extremity and core strengthening, which will help with her transfers, her gait, and her balance. And it will also help to decrease any muscle atrophy that would occur. I'd also encourage more frequent ambulation so she can maintain her functional strength, mobility, and cardiovascular endurance. I'd also encourage frequent movement of her residual limb, especially when the infection is under control, to prevent any contractures and so that the prosthetic can fit properly once the infection is resolved. As I kind of alluded to, we can't really address her prosthetic until her infection's under control, but once it is, we can focus on edema management through the use of an A strap or a shrinker, so that way her swelling decreases and she can fit her residual limb comfortably into the prosthetic.
Awesome. So from a psychosocial component, we really want to address her feelings of hopelessness, frustration, and guilt. And these are stemming especially from the flood due to social isolation, situational distress that we know can lead to depression, and then grief and general distress. So she just lost a church friend. She was displaced from her home. She has these functional limitations. And so what I want to look at her care from is a whole health model. And what this really does is it empowers and enables Miss Staple to take charge of her health. So it takes into account her self-care, professional care, and then the community into a whole health perspective. So we know that Miss Staple prefers in-home care. And so the VA actually has home-based primary care that's for geriatric populations. And what this really does is it brings different providers into the home. So a psychologist is usually a primary component of this. Devon mentioned earlier cognitive behavioral therapy. They can actually come in and do that within the home to address her loss of independence, the family situation, processing traumatic situations, and then really look at things from a strength-based perspective, including her spirituality and the resilience that she's had throughout this time. So to target her social isolation and general distress, I have 3 different areas. So the first one is re-engaging with her church community. So we know that this is very important to her, and we know that she's had trouble due to this flood. So what I would really want to do is try and identify either Bible verses or prayer rituals that she can actually practice within the shelter. And then if it's possible to reconnect with other members who are part of her church community and reform a social support network. So we know Georgie is her pet and means a lot to her, and a pet can provide a lot of social support. We know that Georgie is in a shelter right now, and so what we can actually do is reestablish that bond through frequent photos, videos, talking with people in the shelter, even providing familiar items for Georgie can help Miss Staple feel better. And we know Georgie also has anxiety. And so looking into a possible anti-anxiety medication would ultimately help Miss Staple feel better about Georgie being in a shelter during this time. To target mental health and flood relief, so the Missouri Department of Mental Health actually has services for disasters, including floods. And so they provide mental health care, and that she can reach out to them. They can provide services through the phone or online that specifically deal with a disaster situation, such as a flood. So one of the biggest things is caregiver support. So we know that Hank is her primary caretaker. However, in taking care of her, he's actually inherited caregiver burden. And so to help him, the VA has a caregiver support program. This includes a lot of resources online that are free of cost, including Annie for Veterans, which is an automated text messaging service, so that he can receive text messages that focus on breathing exercises, stress management, and motivational messages. The Senior Alliance also has a caregiver binder that focuses on different areas of caregiving and helps organize and structure so that he feels less burden in taking care of Miss Staple. I also came up with some compensatory strategies to maximize her independence. Of maximizing her independence can ultimately help her feel better. And so I included 3 different areas of collaborative care, incorporating behavioral activation, which we see in cognitive behavioral therapy, and really figuring out her strength-based values and how we can center her goals based on those.
So, in conclusion, we can see that Miss Staple currently has immediate as well as long-term care needs. Her immediate needs include physical health assessment, infection management, medication and functional support, mental health screenings, and environmental adaptations. And we outlined which medical professional would best address these needs. Some of her long-term and more medical needs include management of chronic illnesses and comorbidities, and promotion of community and family engagement, looking at her quality of life, general wellness, and healthy aging, providing caregiver support, education, and advanced care planning.
And so while we come to the conclusion, a few things that we touched on here in terms of challenges that we're faced is just navigating a very complex case. There's a lot going on. Also limited access due to the situation. We know that there's only so much you can do in a situation of flooding and all the other conditions that she's facing. Thirdly, coordinating meetings and working with different professionals in different situations. And so what we learned from all these different challenges is we were able to gather information about what other specialties do, what they can offer, and where to turn to. And so that's going to be helpful as we try to address her needs and any other future needs that arise. We also were able to kind of figure out resources in the community and what she might have access to. And then we also built upon teamwork skills as we tried to work around coordinating and communicating across the disciplinaries. And so taking that forward, a few things that we can continue to grow on is just knowing how to refer appropriately to those professions, knowing when someone else might be able to fix the problem or offer a help that you cannot. And then that kind of goes along with those offering those services, and then just furthering our improved collaboration with those interdisciplinary conversations that we need to have in order to give a full person healthcare plan.
Awesome. Well, we thank you for listening to our presentation and plan of care for Ms. Staple, and taking the time. We really appreciate it.